Hello, everyone. Hi, everyone. This is Camelia. I am logging on live. I was scheduled to come on today around 5 o'clock this evening. It's now about 5:04 p.m. Eastern time. And I just wanted to spend some time just having a sort of an informal Q&A. I know that I have some of you joining me today, but really wanted to welcome you guys in. I see that there's a couple of you here already, so I do appreciate you joining. Hello. If you could tell me maybe who you are, where you're from, and drop that in the chat, it would be great. But I did want to spend some time just sort of talking through any questions that you guys may have, or also some updates to the psychiatry world. I did want to spend some time talking through a little bit of that. Um, but hopefully we'll have more people joining us here. It's now about 5:04 p.m. Eastern time, and um, I'm hoping to have some others join. Looks like Pamela. But yes, you're saying good evening, so it must mean you're in a different time zone. But hello, thank you for joining. My name's Camelia. I'm a psychiatric mental health nurse practitioner, and we'll get going here in just a few minutes. But really wanted to have this time to have you guys as subscribers, or if you're interested in the PMHNP role, to really ask me questions or other things that you've come up with, or that have come up along the way for you as a PMHNP student or a nurse or nurse practitioner. I really just wanted to spend time doing that. So thank you, Pamela, for joining. If you don't mind telling me where you're also from, that would be great, just to get an idea of who I have here. I always like to share very specific information to each state. As you guys know, each state is a little different. So you're Maryland, very good to know. Thank you for dropping that there. So we'll just give a few more minutes here. I see a couple more joining. Again, you guys, if you want to just tell me who you are and also where you're from, what your role is, if you're a student, if you're a practicing nurse looking to pursue being a PMHNP, or whether you're in any other specialty, please drop that here in the chat. Um, I'll just go ahead and introduce myself, and then we'll get into questions, and then I'll share a brief update, something that's pretty pertinent to our role as PMHNPs. But my name's Camelia. I'm a psychiatric mental health nurse practitioner, also known as a PMHNP. You guys may know this, but on my channel, I share this very regularly that I've been practicing for the past 6 years, a little over 6 years now. I've been in nursing. I've been a nurse since 2006. And I am enjoying the ride. I should say that. A lot of people want to know, like, how are things now that you're really into it and you're working? But I'm fully enjoying the ride as a PMHNP. I currently do practice outpatient. I'm full time. I work telehealth. And I've done a few other different areas, both in the office as well as the emergency room. So I've done the psych ED as well. So a lot of the what I share on this channel was actually designed to provide some insight about the role. And one of the things that I've learned along the way in practicing as well as being in nursing is that most of us have the same questions. So I really wanted to spend this time to really chat in real time about questions that you may have. But most of us have the same questions. I do want to take the time to thank you guys, that those of you that have recently subscribed. I've gained quite a few subscribers over these last few months. So I do appreciate you guys also with the questions that you've asked me on and offline. I've been mentoring a couple of you as well, sort of informally. And I really do appreciate that because it keeps me engaged, it keeps me challenged. And the other thing about that is the way I see this is that it really helps to elevate our profession, right? It helps to help us to collaborate to really increase the value of the role of as a PMHNP, and we learn from each other. And so that's the only way, one of the ways that we can grow as professionals. So I do see this as a platform to do that. You guys challenge me just as much as I possibly have challenging things for you on the videos. But I do appreciate you guys for joining as well as subscribing over these last few years. And this channel was developed in 2020, very informally, sort of sporadically, and it's really grown. But I'm really interested to really continue um, spreading awareness and insight and education around the role. Um, I've also coined myself as a nursing and mental health enthusiast, so you'll hear that in a lot of the videos. And really, I'd like to say that the PMHNP role is actually a very great mix of mental health and nursing, which is, of course, our background as PMHNPs. But the skill set really is very specialized, and it's one of the things that I really enjoy about the role. I did actually see that I did a poll of you guys a while back. Those of you that responded, thank you. But I realized that most of you are actually PMHNP students on this channel. And so I do want to take the time too to actually congratulate those of you that have recently graduated. May is usually around that time where people start to graduate. And so hopefully you'll hang around and you'll be able to continue to learn from this channel, but also keep me updated. I always say that when I respond to people on this channel, I really like to know how people are doing. And maybe you're doing something that's completely out of the box or very creative, or something that you're creating your own path for in this role, which I think is the beauty of being a PMHNP, is that you do have some of that autonomy. But thank you guys for joining. I have a couple more that have joined. If you guys want to just drop and tell me where you're from, what your current role is, whether you're practicing or not, or a student. But I also want to just open up the floor right now, as I have others joining, just for any questions that you guys have for me at this point in your journey, about the PMHNP role, the school, your schooling, obtaining the degree, anything that you feel like is unclear, or maybe that you've thought about, that you're kind of thinking ahead about, as it relates to the role. So if you want to just drop any questions you have in the chat, I would really appreciate dropping it there, and then we can talk through it really in real time. So please just drop a question if you have it. I see a couple of you are in PMHNP programs in different states, so that's very important. But what questions do you guys have? I'll just kind of leave a few seconds here for you guys to type any questions for me. Any questions that you have at this point in your journey? And I see some are kind of in and out here. But if you have questions, definitely just put those in the chat for me, or anything that you feel like you want to clarify or don't have a clear understanding about. Um, while I'm waiting on you guys to put questions there, I did want to provide a couple of updates as well, as it relates to the PMHNP role. It's pertinent to our role, that I'll share here in just a few minutes. But also, I know we just finished nursing Nurses Week in May, and so I always like to acknowledge that, although I haven't formally done that in real time, because it is a time for us to really appreciate ourselves. I know that others are normally honoring you as a nurse, and you may get gifts and things like that. But I always use that time of the year as actually a way to reflect on where I am as a nurse, and really understanding sort of what this whole self care thing is about, keeping the balance. And then also reflecting on, what goals I have still in my career as a nurse. So I always like to say that's a good point to try and really figure out what works, what's working, what's not working, what you can do differently, as a way to really show your own appreciation, for what you're doing, but also so that you can continue doing it. I always say, just as a point to just kind of reset and figure out where things are for you in your career. We also just had Mental Health Awareness Month. And I really, really, I take that to heart because as a PMHNP, that is truly what we're doing on a daily basis. We are the heart of mental health awareness. We have the opportunity to educate, we instill hope, we provide treatment, we advocate on a daily basis. And so, Mental Health Awareness Month is always a true reminder of that. But being a PMHNP is a very rewarding journey, and it's something that we get to do every day, which I'm very, very grateful for. Um, Very grateful for. So, I don't have any questions yet. I do have one question here about internships for new PMHNPs. So you may be referring to here in North Carolina, we have something called a journey program, which it's specific to each facility. But what that is actually once PMHNPs graduate, it's a way for you to bridge into your career. I'm not sure if that's what you're referring to, but I will say that those do exist. They're not always necessarily specialized in a way of having one specifically for PMHNPs. The ones that I've actually come across are actually generalized to nurse practitioners. However, I will say that that's a good question for you to ask if you are looking at, doing hospital work or doing anything outside of private practice, because that's where you're going to find most of those internships that will be more formalized, usually in those settings where they're big on education and preceptorships. You're going to find usually the internships or really like a bridge program, or here it's called a journey program where once someone graduates, they're able to go through a formal program where it's supervised. There's psychiatrists on board, and it's really just a good resource for them to bridge into their career. Does that answer your question? Let me know if that answers your question or if you are referring to something else. Yes, to obtain a solid foundation in the role. Yeah, absolutely. Absolutely. So it's not standard. It's not a standard. It's not something that we see often. I would say that it has a lot of value, honestly, because when you are transitioning from RN to NP, generally, there's a huge gap with adjustment to that role. And so a lot of the organizations, particularly the hospital settings, I would say was where I see that most. They've actually seen the value in having some type of program after someone graduates just to be able to bridge into the role. And there's lots of supervision, and some of them actually even have more a didactic setting where they're actually getting kind of like classroom time just to really kind of bridge what they're seeing in clinic, per se. So those do exist. I'm not sure specifically in Maryland, but those are out there. So those would be questions that I would ask as you're learning and figuring out where you want to work. Okay. I have another question. Greetings, Megan. I see Megan Guerrera. I see that you have a question. What's the best first job out of school? You've been an inpatient RN for 2 years while attending a PMHNP program in upstate New York, and you're thinking community mental health. Okay. Yeah, very good question. So you have 1 year left in the program. Yep, very good question. So this becomes very subjective, right? As to when and where do you start. I would say the first thing I would consider is what are your goals? Of course, adjusting to the role is a general goal, but what are your specific goals as you are navigating as you become a PMHNP and you're navigating sort of how you practice? I would say that the community mental health world is an excellent opportunity to consider, primarily because you're going to see lots of different diagnoses. So you're going to really learn how to work with different populations. Okay. What I will say some of the drawback can be is really the resources that are available for community mental health can be more limited. So, in some ways, that can kind of teach you some creativity as a provider and really navigating how you can support patients when you do have limited resources. And what I will say is if you can survive and understand how to survive and help patients to manage in that setting, then you can usually do very well in a private practice or any other type of setting. One, you're getting lots of different diagnoses. You're learning that experience of working with patients with different mental illnesses, and then you're also learning the ropes of resources. And really, the team collaboration is very big in community mental health because you're actually working with lots of other people that really help to support the patient in different ways. So that could be like a social worker. Um, you may be working with various different other professionals to help support the patient. So I would say it's a great experience. I've not worked directly as I've been a PMHNP in community mental health, but that is actually where most of my clinicals when I was in school, it was in community mental health. So I would say it's a great option. You're going to learn a lot, and if that's your goal, to really learn as much as you can, which most of us that is our goal coming out of it. But there can be a period of learning a lot and the feeling of being overwhelmed because of all of the different things that you're going to be really exposed to. However, I would say it's a very good point of growth as a new PMHNP. Okay. That was sort of a long-winded answer, but hopefully that answered your question. Um, and let me know if you have other questions about that. I'm happy to talk offline um, as well. And I see a couple more things. Pamela mentioned that, absolutely, you're welcome. You mentioned that there's a major learning curve from RN to PMHNP. Yes, that curve is there, and really, if we're looking at the foundation of the role. So I will say nursing is a great foundation to the PMHNP role. However, you are going to be transitioning from nurse to you're going to be a provider. And so that's where I see the biggest gap, because you are now executing the orders. You're actually the one actually writing the orders for patients, but you have to have that general basis and that understanding of diagnoses and other symptoms and a lot of different things that you're pulling together to really support the patient. We do that as nurses anyway, but there's a lot more of the leadership role when you become a PMHNP. That's probably something that takes a lot of us by surprise. So there is an adjustment there. It does take time. I can remember my first job was actually as an outpatient, and I was still trying to do things like take vital signs and do other things that you would typically do as a nurse. And so there was a big transition in understanding that the role is different. Although the skill set, it's really a progression of a skill set that you actually acquire as a nurse. So absolutely, there's a learning curve there, and I actually wish that there were more internship programs available. I think as we go, we'll probably have more that will come about, but there's definitely a big learning curve from nurse to nurse practitioner. Yeah. I have another question about any input on how long to work as a PMHNP until starting private practice. Okay, so I'm assuming by starting private practice, you mean starting your own practice. You may be in a state where you can practice independently. Um, so that there's a couple things I want to say about that. Okay, the first thing is um, generally if you're not thinking about your own practice, then private practice, if you're just considering within a certain amount of time going to private practice to work, um, it looks very similar to any other role where there's an adjustment. You have to learn outpatient mannerisms and kind of things that go along with being in the outpatient world. Okay. that doesn't look a lot different than working in other settings. However, if you are looking to start your own practice, which by the way, I'm in North Carolina, so we are not allowed to do that without supervision from an MD. Um, if you're looking to start your own practice, I would say the best measurement or metric for you to determine when you're ready to do that would likely be when you feel confident enough to be able to manage diagnoses alone. Okay. You always still want to have a good resource like an MD in your pocket to really ask questions or any very significant cases that come up. However, you really want to be very well versed in managing the care of patients. You've gotten through that adjustment from RN to PMHNP, and you feel pretty solid about what you're doing without needing a lot of assistance or questioning yourself about things. Everyone's threshold is different for that. So there's no time frame that we can put on that, but typically I would say when I felt ready that I would was able to just delve into things without having anyone over my shoulder per se was probably about 2 years in. And I still learn things every single day. I still have a very great supervising physician that I am able to bounce off questions. But also consider the other reason that it's important to understand where you are and to be ready to do that. Is because if you're thinking about owning your own practice, that's a different skill set that you're going to need. That is going to take some time for you to also get adjusted to. That may take you away from clinical care. Okay. I have worked in private practice with physicians, and a huge part of that is learning how to do business, right? So you just really want to be prepared in that way as well, but you want to have a good foundation to be able to practice independently and then also to be able to balance the role of business and balance the role of the clinical taking care of patients because there are two different skill sets that exist with that most struggle with and in nursing, unfortunately, we're not taught the business side of it. So I would say that that's probably the most important thing to consider. Okay, very good questions. Thank you guys. You guys are rolling in, so I do appreciate it. I see the beautiful life of Trista. Thank you for joining. You are a new PMHNP. You're finishing up your DMP in August, and you haven't started working, but you would love to do something non-conventional. You love kids and healing generational trauma. Yeah, so there are lots of opportunities out there. I would say, the beauty of being a PMHNP is that you can actually really create a path for yourself and advocate for different opportunities or being able to add different things that you want to into the role. So it may not look traditional in terms of when you apply for a job, but I will say that you can definitely probably find something that fits that or you can create that path yourself. I'm curious to know also if you're actually in an independent state where you can actually open your own practice. So please let me know that. But I think that is awesome. So I wish you the best on finishing up. You're almost there, but also being able to explore an avenue that looks pretty non conventional as a PMHNP. That is awesome. You mentioned you'd love to teach life skills or create an educational course for a school. You don't want to do the typical clinical work, but you want to work in the mental health sector. Yeah. So actually, a good place to actually peruse would be the jobs on LinkedIn. I've actually come across a couple of opportunities where there are universities looking for PMHNPs to do things like write exam questions. I was actually a part of a project within the last year doing that. As well as being more of a consultant, that may be more of what you're looking for. There are some of those sort of oddball jobs on LinkedIn that I've come across, and one that I was able to participate in a project to do some of that type of work. So there are many opportunities, I should say. So definitely go for that if that's what you're looking for. Yeah. I also have another question. How would you compare the burnout as an RN versus a PMHNP? I hear PMHNP is very challenging. Well, this requires probably another video, but I'll definitely kind of touch the highlights on that. So I've worked in, just using myself as a personal example. I've been a nurse since 2006. I've worked in a few different areas, including ICU, and I've also done education. And there were points in my career that I felt burnt out. Okay. Um, I'm not sure if my burnout then compares to the burnout that nurses are experiencing now. So I'll just be very transparent about that. However, I am 6 years into my PMHNP role, and the potential for burnout or high levels of burnout as a PMHNP, the potential is there. You are taking in lots of information from people, so there's a potential for information overload. But secondly, you are taking in things that from people that usually aren't good things, right? So the nature of our work is really helping to support people that are going through challenging times, that have challenging mental illnesses. And so I will say that, you know, taking that in every day, when particularly if you're an outpatient, you may have 13 to 16 patients a day. Okay. You're not going to be having every patient with a concern or that's not doing well, but you have to prepare to be that could happen. And so, because you're taking in that type of thing all the time, I will say that that's where the PMHNP role becomes pretty challenging, and the potential for burnout is there. Okay. So the way around that, and my way around that so far, it's not that I don't have periods where things get pretty exhausting, but you have to be able to be in a space of finding a balance early, and figuring out what your thing is, what's your out, how are you going to continue that balance so that you don't become burnout. But that potential is probably there. I don't know that it's there more than it would be at the bedside, but it's definitely there. And I think going into the role as a PMHNP, I always encourage students to start having practices for how they're balancing things, even as a student, just so that you're able to navigate that when you actually get into the role and start practicing with patients. Okay. So hopefully that was helpful for you. And thank you for joining. I know a couple of you are out of state. I'm in North Carolina, as I mentioned, but I do appreciate you guys joining and asking questions. Um, Feel free to continue asking questions here. I'm going to stay on for a few more minutes, but I did want to take a little bit of time to also talk about an update in the psychiatry world. Absolutely, you're welcome. In the psychiatry world, most of you probably know this by now, but it is something, if you don't know it by now, it is going to be good for you to get some insight as to what this is all about. So, you may have heard about the Ryan Haight Act, and the Ryan Haight Act is actually um, an act that was actually produced back in 2008, and it has to do with the connection between telemedicine and prescribing controlled substances. I'm not going to go into the act because there are some exceptions and things that are very specific. So you do want to read about that if you don't know about it. But it actually spills over into our role as a PMHNP, because the DEA, which is our Drug Enforcement Administration, and they regulate a lot of the telehealth regulations as it relates to controlled substances. That actually was revised recently. We've been in a state of emergency since 2020 per the DEA. And so the previous rule was for telehealth providers, actually patients to have to be seen in person for controlled substances. And so that actually was modified per se over these last few years. And now that we're out of the state of emergency, or we're exiting the state of emergency, a lot of those regulations are going back into place. And so, how that's going to affect you if you are a PMHNP practicing by telemedicine is it's actually going to require that you see patients in person at least once for now, if they've not been seen during the state of emergency, if you are prescribing controlled substances. Okay, so that's very specific for us. It's specific for me because I'm a telehealth provider, and I only practice by telehealth right now. But I'm going to say the important thing for you, one, is if you don't know about the Ryan Haight Act and the DEA regulating that, and the state of emergency that was recently lifted, you do want to learn about that. That was extended recently, but there is going to be a time where patients will need to be seen in person at least once, if you are prescribing controlled substances. Okay. You guys know I always like to give you a little bit of insight as to, how that affects you, but also what you should be looking for when you're looking for jobs. So the important part about that is if you desire to be a telehealth provider and you desire to prescribe controlled substances, be sure that you are looking for jobs and organizations that have the opportunity for you to be able to go in person to see patients when necessary. Okay, that is going to be important because there is going to be a time where patients will not be able to get controlled substances until they meet that criteria. Okay, and that's seeing them in person. And so you want to make sure that you are prepared as a provider, because once it comes up where it's necessary and it's going back to sort of the previous regulations, you have to be prepared to either go in an office, or if you're not working for an organization that allows that, you actually are going to be limited as to what you can prescribe to those patients. Okay. So ask those questions if you're interviewing. If there's a physical office, if you are going to be looking for a telehealth position, there are still telehealth positions out there. There aren't as many as before, but I just wanted to say that is a new change, as of May 11th of this year. And so we are having to prepare for that, and it specifically affects us because we do prescribe benzodiazepines, we prescribe stimulants and medications that fall under the controlled substance category. Okay. So just wanted to share that little bit of an update. If you have not heard about it, do your research on it so that you are prepared as a provider, particularly if you want to practice in telehealth. But I'll allow just a couple more seconds for you guys. If you have other questions for me, let me know. But I really, really appreciate you guys coming on, and asking these questions. And as I said, a lot of people have the same questions. And so it's important that we share this information, so that you guys know what to do, what to expect as you are on your journey. Okay. Well, I'm hopeful that this has been helpful to you guys. I am going to plan to sign out now. This will be recorded, or has been recorded, so it will be up for review here in a few minutes. But definitely, if you have other questions, concerns, anything that you want to ask me, feel free to do that on or offline. If you want to do it offline, there is a way to contact me in the bio section of YouTube. But definitely, I look forward to continuing to hear from you guys, and engaging with you guys on this channel. Okay. Well, you guys have a great evening, and I will look to see you guys back in another video here shortly. And you're welcome. No problem. Have a good evening. Bye bye.